Zoe.
And I'm Hannah.
And welcome to NUR2005
Group assignment.
I'm Sophie.
And I'm Georgia. And today we are going to be talking to you about diabetes mellitus, specifically in children.
Diabetes is a condition that affects the body's mechanism in regulating blood glucose levels and maintaining homeostasis.
To start with, there are 3 different types of diabetes you need to be aware of. The 3 types are gestational, type 1 and type 2. So first, let's have a quick look at what they are.
Gestational diabetes occurs within a mother during pregnancy. Pregnant women are more susceptible to diabetes as the body needs more glucose to provide the baby with energy. This can lead to impaired glucose regulation and is managed through diet change, exercise and medication. Gestational diabetes normally occurs in the 2nd trimester of pregnancy and puts a child at an increased risk of developing diabetes in their lifetime.
Type 1 diabetes is when the insulin-producing cells, which are known as beta cells, found in the pancreas are destroyed as a result of the autoimmune dysfunction. This type of disease is when the body lacks insulin and as little to no insulin is produced, and it becomes detrimental to their health. The onset of diagnosis of type 1 diabetes can be from early childhood to 30 years of age, and a medication plan needs to be created. This form of diabetes is a genetic predisposition and is not inherited. However, it is one of the most chronic diseases.
Type 2 diabetes is a slow and progressive disease and is controlled primarily by diet and exercise. Type 2 diabetes is where the body has a reduced sensitivity to insulin produced by pancreatic beta cells, as well as an impaired function of these pancreatic beta cells resulting in impaired insulin production. This type of diabetes is more common among older individuals based upon the reason that type 2 diabetes is heavily related to lifestyle behaviours that cause the onset of diabetes. However, type 2 diabetes is still common amongst children. In a normally functioning body, insulin is used to maintain blood glucose levels.
Insulin is a hormone produced within the pancreas through cells known as beta cells.
Here is Zoe to explain a bit more.
In a normally functioning body, insulin is released from the pancreas into the bloodstream after food consumption. Type 1 diabetes occurs when the beta cells within the pancreas are destroyed by reactions within the body, resulting in minimal or no insulin to be produced within the body. As a result of this, insulin must be injected into an individual's body in an attempt to balance blood glucose levels. However, type 2 diabetes occurs when the body does produce insulin, however not enough is being produced to balance the blood glucose levels.
In regard to children developing diabetes, there are various factors that could increase the risk of doing so. For example, genetic predispositions, post-gestational diabetes, and poor lifestyle choices such as unhealthy eating or minimal exercise are all risk factors that could potentially result in young children developing type 1 or type 2 diabetes.
Genetic predispositions are genetic variations which increase the likelihood of developing a disease which is passed down from family heritage. As well as this, a predominant risk factor is a limited accessibility to receiving healthcare facilities for mothers and children, reducing the ability to diagnose or prevent developing diabetes. This limited accessibility may be due to economic circumstances, lack of education, cultural barriers, or social exclusion, just to name a few.
The first stages of noticing a child may be developing the risk of diabetes. Type 1 in particular is if they present with the following signs and symptoms. From a parent or guardian's perspective, you may notice if a child is producing any of the following. If the child is becoming thirstier and demanding for excessive liquids, this could be a possible symptom.
I'm just so thirsty all the time.
The child may also be passing a lot more urine than usual. You may notice that they are asking to go to the toilet more frequently in a usual day as well.
It's the fourth time I've gone this morning.
Are you noticing that your child is feeling run down or lethargic all the time, in the need of taking more naps than usual, and not being as energetic as a usual child would be?
Georgia, wake up.
Oh, I'm so tired, I just can't stop sleeping.
Are they feeling hungrier than usual, and having an increased appetite may present as a symptom?
I am so hungry.
They may present with wounds and cuts, and you're noticing that they're taking a longer time to heal. They may also present with itchy and irritated skin, such as random rashes breaking out on their body and limbs. They may also experience blurred vision, or if you're noticing your child is losing a lot of weight without any explanation. If their regular diet is still the same and nothing else, this could be the cause of diabetes. If your child is also experiencing regular headaches that are occurring weekly and they are not experiencing any dehydration or lacking sleep, with type 2 diabetes, symptoms may present the same as type 1 diabetes. However, you may notice in your child that they may be progressively gaining weight over time.
If the following signs and symptoms are presented in your child, then you should take your child to the general practitioner to undergo a few diagnostic tests to determine diabetes. There are a variety of diagnostic tests based on measuring the child's blood glucose levels. The first test is a fasting plasma glucose test. This involves taking a blood test from the child the morning after they have fasted the night before to check their blood glucose levels. If the fasting blood glucose level is above 7.0 millimoles per litre, this indicates diabetes. A second test is a random blood sugar test. This means it can be taken regardless whether they have eaten or not, and results of 11.1 millimoles per litre or higher indicate a risk of diabetes. The third test is an A1C test. And this is an overlook of the child's blood glucose levels over the past couple of months, and results of 6.5% or higher over the two tests indicate diabetes. The last test is a urine test. So this involves catching a midstream sample, which allows the doctor to measure the level of ketones present, which also suggests type 1 diabetes.
As type 1 diabetes occurs as a result of the body being unable to make its own insulin, lifestyle changes are ineffective. What this means is that insulin is the only medication which can be used to manage blood glucose levels in people with type 1 diabetes. However, it is also important for individuals with type 1 diabetes to keep a balanced diet as well as to meet their daily exercise requirements for their overall health and well-being. Management of type 1 diabetes therefore includes measuring and documenting blood glucose levels, administering appropriate amounts of insulin, and following diet prescriptions.
Initial treatment of type 2 diabetes involves lifestyle changes. This includes a change of diet. Poor nutrition is a main contributing factor to type 2 diabetes, as an individual's blood glucose levels are raised significantly for prolonged periods of time. This often involves working with a dietitian to create an eating plan, often with the change of diet, which contains small amounts of high glycemic load foods, such as simple carbohydrates. This is done as these foods raise blood glucose levels out of normal ranges quickly. It is also important that diets include a wide variety of food. An increase of exercise is another lifestyle change which can be made. This, along with diet change, assists in weight loss in individuals who are overweight, with being overweight being a significant risk factor for developing diabetes. The American Diabetes Association also recommends individuals consume a well-balanced meal 2 to 3 hours before any exercise greater than 30 minutes. This is shown to assist in the maintenance of adequate blood glucose levels. If lifestyle changes are shown to be ineffective, there are other measures which can be taken. This includes hypoglycemic medication, which lowers overall blood glucose levels as well as can slow the progression of the disease, and insulin. Insulin, unlike with type 1 diabetes, is used as a last resort medication for type 2 diabetes. The blood glucose prick device is a handy device to keep on hand to determine your child's blood glucose levels. This can decide what type of treatment your child needs. This device involves taking a prick with a finger and drawing up a small amount of blood to be sampled and analysed by the device to determine blood glucose levels at that exact time. This can give an indication of how the child's blood glucose levels are going and whether any intervention is needed. Now we are going to show you quickly just how this works. So this is Georgia. So Georgia, would it be okay if today we just take your blood glucose levels?
Yes.
So first we ensure we put on gloves. As a parent taking it, as a person taking it themselves, you don't need to put on gloves. Then what we do is we just turn on the blood glucose machine, like so. Next we open a strip, and you need to make sure you don't put it down or anything to contaminate it. So what we're doing is just, it can be a little tricky to open, put it like that, and then just pop the end into the machine. Next what we're going to do is just grab one of these disposable needles. Now what you're going to have to do is you need to be careful because they are needles. You just twist the end off and it pops out, and then you just twist it and pull. Next what you're going to do is ask your child which finger they would like best. Do you have a preference of finger?
This one's
This one?
fine.
And then what you're doing is you turn the finger around, squeeze it a little bit, and just put the needle on the side and just prick. So then you see the blood comes out, and just pop that blood into the machine like so. Now the machine, and here's a cotton ball to hold on to that one. So the machine has taken our blood glucose to be 6.3. Just ensure the test strip and the needle are placed in the proper waste bins. This is easy for you to do for your child, or for your child to learn how to do for themselves.
Some individuals are also eligible to use an insulin pump. To use a pump, the individual must be diagnosed with insulin-dependent diabetes. This includes all cases of type 1 diabetes and some cases of type 2 diabetes. The individual must also have private health cover. Insulin pumps are computerized devices that mimic the pancreas in the way it administers insulin. They can be slightly difficult to learn how to use, especially by a young child, so assistance by an adult is likely to be required. The pump delivers small doses of insulin via a tube, also known as an infusion set, which is connected to a cannula which is inserted into the individual, usually in the abdomen.
There are preventative measures which children can take in order to reduce their risk of developing type 2 diabetes. Maintaining a healthy weight with a BMI between 18.5 and 24.9. This is important as being overweight or obese is a risk factor for the development of type 2 diabetes. Having a balanced diet. Ensuring that your child is consuming a broad range of food from all the food groups. Getting all the recommended amount of exercise daily. The Department of Health Australia recommends that children aged between 5 and 17 get at least 60 minutes of moderate to vigorous exercise daily. However, as type 1 diabetes is an autoimmune disease, there are no preventative measures which can be taken.
Childhood diabetes can be a difficult concept for a child to comprehend, and a lack of knowledge can often confuse a child. The parents taking primary control over the child's health can overall provide better health outcomes, as the parent has a lot more responsibility than the child. The comprehension of the biological aspects of the condition can potentially confuse the child, and with high parental assistance can lead to a better treatment and glycemic control.
Adequately caring for a patient with diabetes involves having knowledge on being able to educate families on information about diabetes, as well as treatment options available to them. This will work to reduce parents' and children's stress levels by understanding ways that make the situation and diagnosis easier. The role of the nurse is to show a level of comfort in which families feel confident enough to ask questions involved with diabetes and provide supportive answers to wanted outcomes.
Woo! There are some situations when diabetes can majorly affect the child's health and an emergency situation can arise. There were 2 extreme cases in which a child can experience and are both based upon the child's blood glucose levels. A child can present with hyperglycemia, which is related to blood glucose levels being abnormally low. This can be caused by too much insulin existent in the body or an overdosage of glucose-lowering medicines.
A child can present with hyperglycemia by sweating, tremors, a fastened heart rate, sense of nervousness and/or heightened feelings of hunger. Other manifestations could be the child may appear to be confused, complain of a headache, have slurred speech, drowsiness, blurred vision or double vision. In severe cases, disorientation, seizures and loss of consciousness may occur. On the other end of the spectrum, the child may have an abnormally high blood glucose level. If a child is hyperglycemic, they may present with a low blood pressure, extreme dehydration, fast heart rate and other neurological factors related to dehydration. If the child presents with any of these symptoms, it is always recommended that the child is taken care of by a professionally reviewed action plan or be taken to a hospital to be assessed and cared for by nurses and doctors. Hi, what can I do to help my child?
Children and parents can attend camps that offer an enjoyable experience of fun games for children that actively teach them about the disease they have and in a lightened and entertaining way. These camps also do offer the children to meet other children with the same condition and offer a peer support network which cannot always be met with just parents and healthcare professionals alone. It offers children to make friends based upon similar experiences and offers them support and a network of friends to help them in feeling less isolated. The children can enhance their learning from the health professionals and volunteer at these camps in a safe environment.
Thank you.
By the way, as well as other supports, there are many places to go online for added information on diabetes and how to best assist your child to be healthy and happy. This includes kidshealth.org. We've also got Diabetes Australia, which is a really good resource, and Diabetes Victoria peer support groups, which allows people going through a similar situation to share their experiences and knowledge with each other.
Thanks. Thank you for watching our video.
On paediatric diabetes.
We hope you've learned something.
And as a parent or guardian that you can take on all this information. Thank you for watching.